There's this really cool study that is another JEPM publication that came out earlier this year, coming from, again, some people who are very prolific in the research community, which is awesome. And it's looking at the effects of midazolam and lorazepam on food intake in budgies, which are a tiny parrot species. So, um, we often see that sick birds are not eating enough, which is hyporexia, or not eating at all, which is anorexia. Um, and this is really problematic in these birds because these birds have really fast metabolisms, which they do go over here. So these birds, when they're not eating, even for just a couple of days, um, and especially if they have another disease process going on that's kind of making their immune system kind of work on overdrive, we enter this hypercatabolic state very quickly. So they start breaking down their fat stores, their muscle stores, because their body's like, I gotta feed myself. And if they're not getting adequate calorie intake because of either stress or because of some other disease process that's maybe making them nauseous, nausea is something that's a little hard to gauge in birds. Sometimes we do see regurgitation. We don't always see that with nausea in birds. I sometimes wonder if we're seeing nausea in birds, and it's just really hard to recognize if they're not vomiting. Um, because they don't really hypersalivate like other birds, like other animals do or other taxa do. Um, we see that these birds are not eating. That's a problem. They enter this hypercatabolic state and they can die. So that's terrible. In our other, companion species, they're just going over here. Nutritional support is pretty common. We have lots of different ways to provide nutritional support to our more I guess, popular companion species. So, in dogs and cats, we have all kinds of drugs that work really well to stimulate appetite. So, drugs like mirtazapine, which is a tetracyclic antidepressant. There are these new ghrelin agonists. Oh yeah, here they talk about ghrelin agonists. It's a new stimulant in cats in the States. We don't have that in Canada yet, but that's super cool because ghrelin is sort of like the hunger hormone. Um, Corticosteroids, yeah, they kind of make you hungry, but corticosteroids, we would really want to use this and we don't have to. That might be sort of like a Hail Mary to stimulate appetite using a steroid because steroids can have, dramatic physiologic effects on the body. Antihistamines, so like that would probably be cyproheptadine. Cyproheptadine is not a great appetite stimulant in our other pets. We used to use this in cats all the time before the use of mirtazapine became more common. Um, it doesn't work very well. Mirtazapine works much better in my experience. We just don't have that same like range, that same toolkit that we do in our companion mammal patients, our domestic mammals like dogs and cats. Um, we don't have anything comparable in birds. Um, a lot of studies that have been published have been very subjective. He does make reference to a few different studies here because we have been talking about the effect of midazolam as an appetite stimulant in cytosines previously. So it's something that's been kind of floating around in literature for a few years, floating around in conferences. And it's not clear if it's an appetite stimulant exactly or if it's just making the animals less anxious. So in a hospital environment, anxiety, fear are absolutely things that we need to try to mediate if we have to have a bird as an inpatient and we need them to eat. And we either can't do gavage feeding or support feeding, or it's just too stressful to do it. Midazolam, which can be given intranasally or intramuscularly, which is great, can have an effect on food intake, but it's probably because it's reducing their anxiety because it's an anxiolytic. Lorazepam and midazolam are both benzodiazepines. So, midazolam, I'm not sure what the comparable brand name would be in humans. I don't know how frequently this is used in humans, but lorazepam is basically Ativan. Very, very nice benzodiazepine. And the whole reason that they're looking at midazolam versus lorazepam is that in humans, lorazepam is a longer acting benzo. It has anxiolytic effects for a bit of a longer duration compared to something like midazolam, which tends to be quite short acting in many species. The whole point of the study is to kind of evaluate objectively how much do these drugs affect our food intake, and does lorazepam work better because it's longer acting in other species. There's one budgie study that looked at midazolam that was increasing food intake after an hour or within the first hour of administration. And I'm just going to zip down here to the references. So it's number 20 because I feel like it was pretty recent. Yeah, it was also in 2022 in the Journal of Avian Medicine and Surgery. So also super recent, and also by some of the same researchers, which is really funny. So they're like self-referencing their research, which is kind of like, well, I mean, they're doing a lot of research, so you know what? They can self-reference as much as they want. So they're talking about midazolam is a short-acting benzo. Longer-acting benzos might have a more sustained increase in food in budgies or other citizens in hospital, because if we're, only having a very short increase in food intake, then it becomes a little bit either cost restrictive because we're using so much more of a volume of drugs to kind of maintain um, that that consistent food intake throughout the day, and it's more handling of the patient. So presumably you'd be using this because you don't want to do nutritional support to on your patient, so gavage feedings, or place a feeding tube, which my experience with feeding tubes in birds has been mostly esophagostomy tubes for birds who had crop burn, and they had like a giant hole in their crop. So then we place an esophagostomy tube below the crop or aboral to the crop, and then we let the crop heal. Often surgery is needed, but it's been many, many years since I've seen one of those cases, which is great. I don't deal with a lot of avian breeders right now. Not many of them seem to seek out veterinary care in this province, which is unfortunate. But I mean, maybe it's just because things are going well. Ooh, hope so. Hard to say. So, my experience with feeding tubes again in birds is pretty limited, and it's kind of distant from what we do in modern medicine anyway. But typically, like that's our main reason for placing a feeding tube in a bird is if there is some kind of crop injury, and we need to ensure that we can give some nutritional support directly, because if you're just feeding them orally, then it just kind of like falls out of their crop hole if they have like a crop burn or some other injury, like a penetrating injury. So that's terrible. So back to the drugs. So they're talking about how theoretically lorazepam maybe will work longer. Let's find out. And it says lorazepam can be administered IM or intranasally, which is great. Midazolam, again, I've used midazolam intranasally in birds for years, and I love it. It can work really well if there isn't any like rhinolith or any other um, upper respiratory disease. It's really nice because you don't have to poke the bird, but if they sneeze it out, then you kind of don't know what dose you're getting. So they're looking again. Food intake after IM, intramuscular administration of midazolam, as well as lorazepam. So they used a bunch of budgies. They used 22 budgies that were from a pet store. So maybe probably from the same commercial supplier. Usually pet stores will use like a single commercial supplier for birds. So these birds might be genetically kind of similar. Um, they were provided a seed mixture because burbs love seeds. Budgies are granivores, so if you are feeding them a very varied seed mixture in addition to fresh foods, it can be a reasonably balanced diet. Although we do try to kind of lean a little bit more heavily on getting these birds pellets just for balanced nutrition. But obviously, these budgies that are just intended for a short-term study, who came from a pet store who've probably never seen a pellet in their life, like let's just offer them seeds. And then millet as treats because burbs love millet. They made sure the birds were healthy. So it was randomized, blinded, balanced, complete crossover design. So all those wonderful words that we like to see that show that this study is removed from as much bias as possible, which is awesome. And then they actually recorded videos of the budgies, which is really interesting, and really great because there's definitely a principle in like in wildlife science or wildlife biology that you change your observations just by observing something, because these animals that are prey animals are exceptionally good at knowing that you're there, and they may change their behavior, sorry, just because of your presence. So recording these animals just kind of helps remove that tentative variable. Because again, birds love masking phenomenon. We see birds all the time that, the first couple minutes in the exam room while you're taking your history, they're like, yeah, I'm a healthy bird. I'm, doing bird things. And then, 5 minutes in, 10 minutes in, they start to like do the puffy and fluffy and they're acting a little bit more sick. And it's like, aha, you were hiding it and you were hopped up on adrenaline from the ride here. And because I might be a predator, which I'm not, I never have eaten a patient. They don't believe me, but I have never eaten a patient. So, they did evaluate sedation because midazolam does have a sedative effect. Midazolam is one of again, the safest drugs that we use for procedural sedation for birds, which we touched on last time when we looked at, oh, sorry, not last time, like maybe 2 streams ago, when we looked at that really good paper on avian sedation. Love, love, love midazolam because it is quite safe. It doesn't really affect cardiovascular output, and it's reversible. And it's anxiolytic, and we love it. And maybe a little bit of amnestic effect, which is also great. So, injections were administered during the day because this is a diurnal species, of course. We're not doing this at night, outside of their activity cycle. And um, so let's just look at these charts because, like, looking at the numbers is kind of annoying. It's kind of hard to interpret when you're just looking at the numbers. So they have wonderful charts. So, effectively, both of these drugs did increase food intake over the first hour to first, I guess, 2.5, 3 hours. So midazolam had a greater effect on food intake, but lorazepam did have a slightly longer effect. So only 2.5, 3 hours. So not substantial, but maybe enough to get them to start eating, and maybe enough um, to I guess help cease that like hypercatabolic state that these birds are entering. So they are looking at cumulative food intake over time. So um, after they did that initial dose, they did measure how much food these birds ate over the rest of the day. And I'm not sure if this is not super statistically dramatic. So we definitely saw that midazolam and lorazepam had kind of a comparable effect over the remainder of the day, and that was statistically significant, sorry, from no drugs at all, or the control, which was like sterile water or sterile saline. So that's super cool. So both of these drugs did effectively, after one dose, even though we saw that, the effect of midazolam kind of petered off. Um, Short term, and lorazepam lasts a little bit longer, they still had a positive effect on what these animals ate over the whole day. So that's really neat. Um, so yeah, compared with control, birds treated with midazolam or lorazepam, so they showed some signs of sedation following administration. So I guess I don't know, they were like kind of high and kind of hungry and less anxious. Yay, midazolam, birdie Valium, right? Um, and of course, the highest percentage of sedation occurred during the first hour after administration, which is not a surprise. Midazolam does tend to work really quickly when we're using it for procedural sedation, and then these doses are consistent with what we would use for like a light procedural sedation. And of course, like our procedural sedations, we're usually pairing that midazolam with something like butorphanol, which has a nice sedative effect and is actually a good pain management drug in birds because birds are weird. Um, So, midazolam treated animals showing behaviors consistent with sedation. That's great. And then lorazepam treated birds. So, less of a percentage of time compared to some birds acting sedated after just the control, which, okay, cool. Thanks, birds. What is that? Like a placebo by proxy? I have no idea. Maybe the birds were just tired because they had a very stressful day and they were acting really tired. So, that's really interesting. Yeah, so this is a super cool study because this is supporting the use of these short-acting benzodiazepines. Um, Even though like lorazepam Ativan is like a longer-acting benzo in people, it's relatively short-acting in birds, or seems to be relatively short-acting in birds. But then we did see a positive effect on their food intake throughout the whole 12-hour day. So that's really cool. And then they're suggesting that future studies should evaluate if midazolam is dose dependent or if the appetite stimulant effect is dose dependent. So, can we use a lower dose which will provide less sedation, but maybe is providing more anxiolysis or anxiety reduction so that we can have that nice happy medium of they have just enough to kind of take the edge off to make them less anxious, but not enough to make them dopey. Because certainly if we are sedating them unnecessarily, then that's not ideal. Like we want to try to use the lowest effective dose of a drug with the most minimal side effects, regardless of the species. So really, really great study. I think this is super interesting. It's really great that we're seeing these types of studies now for our exotic patients.